NCSBN-NCLEX RN 800 questions newest full practice with answers. Question 1. What is the most serious side effect of MAO inhibitors? Option A, hypertensive crisis. Option B, severe rash. Option C, severe hypotension. Option D, severe diarrhea. The correct answer is option A, hypertensive crisis. Ingestion of tyramine with MAO inhibitors can provoke a life-threatening hypertensive crisis. Question 2. Which category describes a schizophrenic experiencing hallucinations? Option A, impaired communication. Option B is sensory perceptual alterations. Option C, altered thought processes. Option D, impaired social interaction. The correct answer is option B, sensory perceptual alterations. Hallucinations are false sensory perceptions not associated with real external stimuli. Question 3. A schizophrenic client believes he is a messenger from another planet. What is this? Option A, ideas of reference. Option B, delusions of persecution. Option C, thought broadcasting. Option D, delusions of grandeur. The correct answer is option D, delusions of grandeur. Grandiose delusions involve the belief that one has omnipotent or superhuman powers. Question 4. A client believes people want to use her body for science. What is the best response? Option A, describe the people. Option B, why do you think that? Option C, there were no people. Option D, I know that must be frightening. The correct answer is option D, I know that must be frightening. Focusing on the client feelings reinforces reality while acknowledging their distress. Question 5. How does a nurse assist a client with anorexia nervosa to feel more in control? Option A, establish a structured environment with routine. Option B, distract the client during meals. Option C, frequent room checks. Option D, participate in in-depth discussions about food. The correct answer is option A, establish a structured environment with routine. Structure and routine provide safety and help the client develop internal control, reducing the need for self-starvation. Question 6. An alcoholic client says he is not an alcoholic. What is the best response? Option A, the fact is you are an alcoholic. Option B, I understand it took strength to admit yourself. Option C, if you can stop, why do you not stop? Option D, it is good you can stop when you want. The correct answer is option B, I understand it took strength to admit yourself. A supportive attitude builds trust, and focusing on strengths helps raise the client's self-esteem. Question 7. What nursing strategy is helpful for an Alzheimer client with memory impairment? Option A, maintain routines and adherence to schedules. Option B, encourage attendance at all activities. Option C, ask questions until answered. Option D, give the client many choices. The correct answer is option A, maintain routines and adherence to schedules. Consistent routines are vital because Alzheimer clients cope poorly with changes in environment or schedule. Question 8. How should a nurse approach an out-of-control client? Option A, least restrictive measure. Option B, challenge behavior immediately. Option C, leave the client alone. Option D, place in seclusion immediately. The correct answer is option A, least restrictive measure. The least restrictive measure model ensures client rights are respected while maintaining safety. Question 9. What is the goal for a passive-aggressive client? Option A, allow use of humor. Option B, express anger using iMessages. Option C, allow time away from duties. Option D, allow excuses for forgotten information. The correct answer is option B, express anger using iMessages. Using iMessages promotes assertive communication and replaces the covert aggression of passive-aggressive behavior. Question 10. A client last menstrual period began June 10. What is the estimated date of confinement? Option A, March 17. Option B, June 3. Option C, August 30. Option D, January 10. The correct answer is option A, March 17. Using Nagili rule, count back 3 months from June 10 to March 10 and add 7 days. Question 11. What is the purpose of a circlage procedure? Option A, reinforce an incompetent cervix. Option B, repair amniotic sac. Option C, evaluate cephalopelvic disproportion. Option D, dilate the cervix. The correct answer is option A, reinforce an incompetent cervix. A circlage encircles the weakened cervix with a suture to prevent premature dilatation and loss of pregnancy. Question 12. A client in the supine position during an exam becomes lightheaded and pale. What is the priority intervention? Option A, place in Trendelenburg position. Option B, assess for vaginal bleeding. Option C, obtain vital signs. Option D, a help to a sitting position. The correct answer is option D, help to a sitting position. Sitting helps move the gravid uterus off the inferior vena cava and alleviates maternal hypotension. Question 13. What is the greatest risk to a fetus born prematurely? Option A, hyperglycemia. Option B, hypoglycemia. Option C, intestinal immaturity. Option D, lack of lung development. The correct answer is option D, lack of lung development. Insufficient surfactant in the preterm fetus is the greatest risk and leads to respiratory distress. Question 14. A client receiving Retidrine must be observed for which side effect? Option A, hypoglycemia. Option B, hyperkalemia. Option C, tachycardia. Option D, increase in hematocrit. The correct answer is option C, tachycardia. Retidrine causes vasodilation leading to hypotension, which is compensated by an increased heart rate. Question 15. How should a client prepare for a non-stress test? Option A, start intravenous infusion. Option B, drink glasses of water. Option C, do not eat or drink. Option D, remain as still as possible. The correct answer is option D, remain as still as possible. Any maternal activity can interfere with the recording of the fetal heart rate during the test. Question 16. Results show fetal heart acceleration of 15 beats per minute lasting 15 seconds twice in 20 minutes. This is option A, reactive test. Option B, non-reactive test. Option C, unsatisfactory test. Option D, negative test. The correct answer is option A, reactive test. A reactive test shows FHR acceleration of at least 15 beats per minute lasting at least 15 seconds within 20 minutes. Question 17. What complaint by a laboring client indicates hyperventilation? Option A, I am cold. Option B, I have a backache. Option C, I feel dizzy. Option D, I am nauseous. The correct answer is option C, I feel dizzy. Dizziness is an early symptom of hyperventilation caused by the excessive elimination of carbon dioxide. Question 18. What does station 1 indicate regarding the fetus? Option A, 1 cm below ischial spines. Option B, 1 cm above ischial spines. Option C, not entered pelvic inlet. Option D, located in pelvic outlet. The correct answer is option B, 1 cm above ischial spines. Station is the relationship of the presenting part to the spines with negative numbers indicating a position above the spines. Question 19. What is the effect of left occipital posterior position on labor? Option A, decreases time of labor. Option B, prolongs first stage of labor. Option C, decreases time of first stage. Option D, prolongs third stage. The correct answer is option B, prolongs first stage of labor. The posterior position forces the fetal head into a larger diameter, resulting in a slower transit through the pelvis. Question 20. A client has an epidural with bupivacaine. What side effect must the nurse monitor? Option A, hypertension. Option B, hypotension. Option C, hypoglycemia. Option D, hyperglycemia. The correct answer is option B, hypotension. The vasodilatory effect of bupivacaine leads to a lowering of maternal blood pressure. Question 21. The nurse should discontinue oxytocin infusion if Option A, contractions are less than 2 minutes apart. Option B, duration of contractions is 60 seconds. Option C, uterus relaxes between contractions. Option D, client complains of being tired. The correct answer is option A. Contractions are less than 2 minutes apart. There must be a resting phase between contractions to allow for re-establishment of blood flow to the fetus. Question 22. A client is being prepared for cesarean section. Which order should the nurse question? Option A, meperidine 100 mg IM. Option B, discontinue oxytocin. Option C, insert Foley catheter. Option D, prepare abdominal area. The correct answer is option A, meperidine 100 mg IM. Narcotics cross the placental barrier and cause respiratory depression in the newborn, making them inappropriate for cesarean section preoperative orders. Question 23. Cesarean delivered infants are at increased risk for Option A, cold stress. Option B, cyanosis. Option C, respiratory distress syndrome. Option D, seizures. The correct answer is option C, respiratory distress syndrome. Cesarean delivered infants do not experience chest compression through the birth canal, preventing the expulsion of lung fluid. Question 24. Before a newborn is taken from the delivery room, what intervention must be completed? Option A, a physician verifies time of birth. Option B, a nurse counts instruments. Option C, a nurse instills eye ointment. Option D, mother and newborn tagged with identical bands. The correct answer is option D, mother and newborn tagged with identical bands. Identical identification bands ensure the safety and correct matching of the infant with the mother. Question 25. What is the best position to assess the perineum and anus of a postpartum client? Option A, Sims position. Option B, Fowler position. Option C, prone. Option D, any position. The correct answer is option A, Sims position. The Sims position provides optimal visualization of the perineum and anal area during assessment. Question 26. What is the initial nursing intervention for a bruised perineum on the second postpartum day? Option A, expose area to air. Option B, apply ice. Option C, encourage warm sitz baths. Option D, inform physician. The correct answer is option C, encourage warm sitz baths. Warm moist heat from sitz baths promotes circulation and comfort for episiotomy healing. Question 27. What is the correct technique for manual milk expression? Option A, a compress and release nipple. Option B, a roll the nipple. Option C, slide fingers forward from areola. Option D, a compress areola border. The correct answer is option D, compress areola border. Positioning fingers at the outer border of the areola and compressing is where the milk sinuses are located. Question 28. Which exercise is recommended in the first few days postpartum? Option A, push-ups. Option B, jumping jacks. Option C, leg lifts. Option D, Kegel exercises. The correct answer is option D, Kegel exercises. Kegel exercises help to stimulate muscle tonus in the perineal and vaginal areas. Question 29. A cardiac client experiences weakness, shortness of breath, and crackles. He is developing Option A, extension of myocardial infarction. Option B, pneumonia. Option C, pulmonary edema. Option D, pulmonary emboli. The correct answer is option C, pulmonary edema. Pulmonary edema is manifest by shortness of breath, weakness, and crackles, often due to left ventricular failure. Question 30. What is the most appropriate position for a client with pulmonary edema? Option A, high Fowler. Option B, lying on left side. Option C, sitting in a chair. Option D, supine with feet elevated. The correct answer is option A, high Fowler. High Fowler position decreases venous return and allows for maximal lung expansion. Question 31. What medication is administered in heart failure to improve contractility? Option A, digoxin. Option B, furosemide. Option C, oxygen. Option D, nitroglycerin. The correct answer is option A, digoxin. Digoxin is a cardiac glycoside that increases the force of myocardial contraction. Question 32. What does a weight gain of 2 pounds in 24 hours indicate in heart failure? Option A, diet too high in fat. Option B, decreasing cardiac output. Option C, decreasing renal function. Option D, a diabetes insipidus. The correct answer is option B, decreasing cardiac output. Decreasing cardiac output leads to fluid retention, which is reflected by rapid weight gain. Question 33. What is the estimated date of confinement for a woman whose last menstrual period began on May 20th using the Gili rule? Option A, March 27th. Option B, February 1st. Option C, February 27th. Option D, January 3rd. The correct answer is option C, February 27th. To calculate the estimated date using the Gili rule, subtract 3 months from the date of the last menstrual period and add 7 days. Question 34. Which symptom is a common physical change experienced during the first trimester of pregnancy? Option A, nausea and vomiting. Option B, quickening. Option C, 68-pound weight gain. Option D, abdominal enlargement. The correct answer is option A, nausea and vomiting. Nausea and vomiting occur in almost half of pregnant women during the first 3 months due to elevated human chorionic gonadotropin levels. Question 35. A 38-year-old pregnant woman who is 30 weeks gestation is at an increased risk for which condition related to her age? Option A, iron deficiency anemia. Option B, sexually transmitted disease. Option C, intrauterine growth retardation. Option D, pregnancy-induced hypertension. The correct answer is option D, pregnancy-induced hypertension. Pregnant clients older than 35 have an increased risk for pregnancy-induced hypertension, cesarean delivery, and mortality. Question 36. A client at her 6-month prenatal checkup has gained 10 pounds in 2 months. How does the nurse interpret this weight gain? Option A, she is compliant with her diet. Option B, she needs further instruction and reinforcement. Option C, she needs to increase her caloric intake. Option D, she needs to be placed on a restrictive diet immediately. The correct answer is option B, she needs further instruction and reinforcement. 10 pounds in 2 months is considered excessive weight gain, warranting a re-evaluation of eating habits and dietary reinforcement. Question 37. What is the recommended serum glucose range during pregnancy to prevent perinatal mortality? Option A, 70 to 120 mg per deciliter. Option B, 100 to 200 mg per deciliter. Option C, 40 to 130 mg per deciliter. Option D, 90 to 200 mg per deciliter. The correct answer is option A, 70 to 120 mg per deciliter. The recommended range is 70 to 120 mg per deciliter to reduce the risk of perinatal mortality. Question 38. When a fetal monitor displays late decelerations with tachycardia and decreasing variability, what action should the nurse take? Option A, continue monitoring. Option B, turn client on right side. Option C, decrease intravenous fluids. Option D, report to physician or midwife. The correct answer is option D, report to physician or midwife. Late decelerations indicate fetal distress requiring immediate intervention, such as reporting to the physician, turning the mother on her left side, and administering oxygen. Question 39. What is the predominant purpose of the first APGAR scoring of a newborn? Option A, determine gross abnormal motor function. Option B, obtain a baseline for comparison. Option C, evaluate the infant vital functions. Option D, determine the extent of congenital malformations. The correct answer is option C, evaluate the infant vital functions. The purpose of the APGAR system is to evaluate the physical condition of the newborn at birth to determine if there is an immediate need for resuscitation. Question 40. Which food choice provides the greatest amount of protein when added to milk for a pregnant client? Option A, light cream and corn syrup. Option B, powdered skim milk and 1 egg. Option C, a vanilla ice cream and chocolate syrup. Option D, a vitamin-fortified gelatin drink. The correct answer is option B, powdered skim milk and 1 egg. Skim milk adds protein and eggs are good sources of protein while low in fat and calories. Question 41. Which finding would be considered abnormal in a postpartum woman? Option A, chills shortly after delivery. Option B, a pulse rate of 60 beats per minute on first post-delivery day. Option C, urinary output of 3,000 milliliters on second day. Option D, oral temperature of 101 degrees Fahrenheit on third day. The correct answer is option D, oral temperature of 101 degrees Fahrenheit on third day. Any temperature greater than 100.4 degrees Fahrenheit on the third day needs further investigation to identify any infectious process. Question 42. What is the most effective method to identify early breast cancer lumps? Option A, mammograms every 3 years. Option B, yearly checkups by physician. Option C, ultrasounds every 3 years. Option D, monthly breast self-examination. The correct answer is option D, monthly breast self-examination. Monthly breast self-examination has been shown to be the most effective method for early detection as 95% of lumps are detected by women themselves. Question 43. Which risk factor associated with breast cancer would a nurse consider most significant in a client history? Option A, menarche after age 13. Option B, nulliparity. Option C, maternal family history of breast cancer. Option D, early menopause. The correct answer is option C, maternal family history of breast cancer. A positive family history puts a woman at an increased risk of developing breast cancer and requires earlier screening. Question 44. What is considered the most important prognostic factor for a client with breast cancer? Option A, tumor size. Option B, axillary node status. Option C, client previous history of disease. Option D, estrogen progesterone receptor assays. The correct answer is option B, axillary node status. Axillary node status is the most important indicator for predicting how far the cancer has spread.